Hello there, I'm Dr. Catherine Bolter, here today to talk to you about the hormone-mood connection, trying to help you be educated about how hormones affect your health and so that you can get on towards feeling your best. I'm one of 9 naturopathic doctors at Revolution's Naturopathic Medical Clinic. We are located in Folsom and Roseville, California. And we aim to holistically address all of our patients' health needs. One of the important things in naturopathic medicine are these 6 principles. They guide the way that we treat our patients. And if you look down here, one of them is physician as teacher. And so it's very important to us to do our best to educate our patients into understanding their health and why they're being treated the way that they are. One of my mentors said that if we're doing a good job, we will educate our patients so well that we won't have a job. This talk is going to address hormones for both men and women. They vary a lot, as you, I'm sure, have experienced in your own life. Men, we mostly think about testosterone, which is why we've got a 1-lane road here. And then for women, it's a little bit more complicated with ups and downs and ratios. And technically, men and women have all the same hormones, but they affect us a little bit differently. One thing that is the same, though, is that all of our sex hormones are made from a cholesterol molecule, and there's a connection between our cholesterol levels as we age and sex hormones, and it's pretty interesting. And then feeling good with hormones is definitely all about balance. You need things to be present in the right levels and in the right ratios to feel your best. And then this little acronym here kind of points out the hormones that we're going to be talking about today: progesterone, oxytocin, testosterone, estrogen, and then cortisol and thyroid hormones as well, because it's not just the sex hormones that affect our mood. There's a lot of information on these slides, but I'm going to highlight some of the information that talks about how it affects our emotions for today. Most of the concerns for men are based on testosterone, and so that's the information I've provided you here. In terms of testosterone and emotions, when things are off, men tend to start feeling a decrease in their motivation and self-confidence. They tend to start having brain fog or difficulty focusing on tasks, and can get an increase in depression or anxiety. Testosterone does a lot of different things in terms of mood and brain health. It really affects your memory, and that anxiety piece is a big one. And just general overall mood elevation has a lot to do with testosterone. In women, it has a lot to do with memory and self-confidence and motivation as well. When men are deficient in testosterone, they can start feeling more indecisive. They can really lose that self-confidence. They can become more submissive. You can become more fearful or just lose interest in things that used to be exciting to you. Female hormones, that curvy road that we were looking at the beginning, are a little bit more complicated. And this is our cycle throughout the month. And so as you can imagine, to get everything to happen just right and to feel balanced and normal, all of these things have to work out. One of the most common things that I hear from women that I wanted to point out in today's talk is that I think society and has normalized the idea that PMS is normal, that periods are uncomfortable, and that feeling cramping and pain and irritable and terrible during your period is just something that we all have to put up with. And it's not true. If you have a good hormone balance, good nutrient levels, and a good detoxification system, then periods can actually be quite comfortable. Maybe not everybody's favorite thing still, but it doesn't have to be agonizing, and it doesn't have to feel like you want to murder people for the week before. So let's dive in a little bit. Of course, there's the difference between being premenopausal and postmenopausal for women. And that definition is premenopausal is obviously having a regular cycle. Menopausal means that you've had no cycle for a whole year. And premenopause hormone imbalance can look like PMS. It can look like premenstrual depressive disorder, which is really significant depression before your period. Can look like anxiety, can look like just wild mood swings and irritability. And then post-menopause, mood swings and anxiety for sure are big issues. Estrogen has huge effects in our body, and we're not going to go through all of them today, but in terms of mood, helps with memory and concentration. And when those things are not working well, we get frustrated, and it kind of has downstream effects. And then this picture over on the right, I just wanted to point out, is actually estrogen crystals under a magnifying glass. I thought that was really neat. If we have too much estrogen, we tend to feel more depressed, more of that anxiety and irritability, along with all of the other symptoms that can come along with estrogen excess. These are things that you might typically associate with PMS, like breast tenderness, fatigue, cramping, things like that, low libido, poor sleep, which feeds into those mood issues for sure. If we're not sleeping well, we're not feeling good. And then on the right here, I noted some of the causes that can lead to estrogen excess, because I want to empower my patients to understand that there are lifestyle things that you can do to help balance your hormones. It's not just about getting a hormone test and then and getting hormone replacement. Those are not our only options. Too little estrogen can definitely make us anxious. So it is just about finding that magic balanced middle ground to feeling good and stable. Progesterone, naturally calming. We think of it as a neurosteroid, which means it just is calming to our nervous system in general, reduces inflammation there, and reduction of inflammation in our nerves definitely makes us feel calmer. Helps us sleep well with all the good downstream mood effects of good sleep. And then it helps prevent anxiety, irritability, and those mood swings, kind of the counterpoint balancer to estrogen, which is why estrogen dominance is something that we talk about so often. People can feel really terrible and unbalanced when that's what they have going on. Too little progesterone, that anxiety kicks up again, those mood swings and irritability. So we're kind of picking up on a theme there that those, if you're experiencing anxiety, mood swings and irritability, especially that is cyclic throughout your period, where it's getting worse right that week before your period, or really kind of has a cyclic pattern at all, we're definitely going to look at your sex hormones to see, is that what is affecting your anxiety? And then causes of progesterone deficiency, lots of them, but the one I wanted to point out is if you're someone who's been on antidepressants for a long time, it's possible that your progesterone is low or acting like it's low, and we might need to kind of help you with that. Oxytocin, not one that we talk about that often, but it is the love hormone. It does help us connect and bond with our friends, family, and partners. And so if you're not feeling like you want to bond, or you're not feeling like you're you're able to bond very well, there could be a problem with oxytocin. It also makes you feel more socially isolated, whether or not you are. And then anxiety, depression, again, is a big one. And then it's not just about the sex hormones. Thyroid and adrenal hormones also play a big role. All three of these categories kind of work to balance each other out in our bodies. And if any one of them is off, really, we will not feel very good. Thyroid, yep, is that little gland that lives in your neck. It's kind of the master metabolism conductor. So thyroid hormone affects virtually every cell in the body, really, there's nothing that it doesn't touch. And so, as you can imagine, it definitely contributes to how we're feeling. And then, hopefully you can see this, but thyroid, we typically talk about issues with thyroid in having too little thyroid hormone or too much. Too little slows us down, and so we get a lot of symptoms of low metabolism, including depression. And then too much or hyperthyroidism kind of speeds everything up, and we get much more nervous, irritable, and anxious when we have too much thyroid hormone. Most of us are on the hypo side or low thyroid side, but there are a percentage of people who have too much thyroid hormone. And it can change throughout your life. So definitely something to get evaluated if you're having issues with anxiety, depression, weight gain or loss, and any of these other symptoms in my list here. And then the adrenal glands, those little glands that sit on top of your kidneys and produce several different hormones. Cortisol being the one that I'm going to talk about here most, but also hormones that help regulate your blood pressure and electrolytes. And then they also produce sex hormones, especially when we're in that postmenopausal category, where our ovaries have stopped making as much estrogen, progesterone, or for a man, the testes have ramped down testosterone production. The adrenal glands are there to catch us a little bit. But if we've spent a lot of our lives being stressed, and stress includes things like mental stress, physical stress, not sleeping well, not eating regularly, having blood sugar issues, having a lot of inflammation, then our adrenal glands might not be there to catch us when we go through menopause or andropause. And it can make the symptoms of that change a lot worse than they would otherwise be. Symptoms of the adrenal glands not functioning very well. The mood symptoms that you might notice are being overly emotional or having that brain fog, just kind of thinking through mud or having really difficult time focusing. And then anxiety and irritability, again, pop up for us. And then again, coming back to the idea that balance is the key. And I wanted to just talk about a few ways that we can get to hormone imbalance and then how to get back again. Hormone replacement therapy is definitely one option for balancing our hormones. It's not appropriate for everyone, but especially in that postmenopausal or andropause range, or if you've had to have a complete hysterectomy or something like that, hormone replacement may be an option for you and can be really helpful. I wanted to point out that there are both bioidentical and synthetic versions of hormone replacement, and our body metabolizes those differently. And so, coming in and talking with a doctor about those options and why you might choose one over another is important, so that you're making an educated decision about something that you're gonna put into your body and how you might feel with those hormones. Some of the ways that we can get to hormone imbalance have to do with our environment. Pollution in the air, pollution in the water, eating too much meat that contains a lot of hormones, and antibiotics, food that has pesticides or different kinds of additives in it, plastics, which can be endocrine disruptors, meaning that they can fit into the little receptor sites for our normal hormones and kind of make the signaling in our body go a little bit haywire. The products that we use, especially in our bathrooms or to clean our houses, can be disruptive to our endocrine systems. And so being careful about everything that we're putting into and onto our bodies is really important in terms of staying balanced throughout our lives. Getting sun exposure, the right amount, but not too much. And then heavy metal exposure through all those pollutants and or our jobs throughout our lives. And that accumulation of heavy metals can also be really disruptive. That all being said, detoxification can be an important component in hormone balance and regulating your mood as well. We all detoxify a little bit differently, and part of that is due to genetics, and part of that is due to the load that we've accumulated over our lives. And so making sure that we're getting the nutrients that we need so that all of our detoxification systems can work the best that they can. Getting good exercise and sweating is really important in terms of helping our body push out those toxins. Making sure that you're staying hydrated and having regular bowel movements, also super important for detoxification. And then just noting again that a lot of the enzyme systems that our hormones are dependent on to signal our cells to do the jobs that they want them to do are dependent on various different nutrients. And so making sure that we have those nutrients present in our bodies to help those enzymes work better is really important. Because the hormone can be there, but if it can't signal because you're missing a B vitamin, then the whole system doesn't work either. So complex, but we can do it. And that's kind of the overview of hormones and mood and why it might matter and what you might want to do about it. This slide is just to tell you that we offer free 15-minute visits at Revolution's Naturopathic. That's to coordinate care and to get your questions answered by one of our doctors and see if our practice would be a good fit to meet your health needs. If you're interested, you can call our front desk and they're really good at explaining how to get started with us. So if you're experiencing any of the issues kind of talked about in this PowerPoint and want to learn more, this is one way that you can have access to an awesome doctor who wants to talk to you about your own individual health concerns. All right, thank you very much.